want to help. That's why today we are launching an urgent appeal, the DEC Turkey Syria earthquake appeal. Tonight, after the evening news, appeals will be broadcast on BBC, ITV, Channel 4, Channel 5, Sky, and across radio. They will be presented by Daniel Craig, Tamsin Gregg, and Sir Michael Palin. We are hugely grateful to all for getting this message out. By working together with our charities on the ground and their local partners, we hope to reach millions of people across the region who are in need of immediate help to survive. The earthquake has destroyed thousands of buildings in Turkey and in Syria, leaving people in freezing conditions. We've just heard that now more than 17,000 people have lost their lives, and that number will only rise. Many more are still trapped under the rubble. Millions are in desperate need of humanitarian assistance. DEC charities, including Islamic Relief, Age International, ActionAid, and the British Red Cross, are already in the ground in Turkey and in northern Syria, providing life-saving aid. But they need more funds to help rescue people from the rubble and provide further food, clean drinking water, and shelter to the survivors. I've just got back from Ukraine, where I saw for myself the huge impact that the donations from the British public are having on people's lives. Now, sadly, people in Turkey and Syria need our help. I know DEC charities can make a huge difference there as well. Today, we have 4 aid workers joining us to tell us about the situation on the ground, to provide an insight into how they are reaching out to the most vulnerable people with vital aid. After they have spoken, there will be an opportunity for you to ask questions to them. So please do use the Q&A function at the bottom of your Zoom screen. First, I'm going to introduce to you Salah Abdul Qasim from Islamic Relief. Salah is based in Gaziantep, which has been badly affected by the earthquake. Salah, please tell us what you have been witnessing.
Thank you, Salah, and welcome to everybody. Thank you for giving us the opportunity. I arrived around 14 hours after the earthquake, the early hours of late night on Monday to Gaziantep. I've been working in the humanitarian space for more than 15 years. I've been to many disaster zones, I've been to many war zones, and I have to say that the size and the scale of this is unprecedented. The numbers are huge. Yesterday, I spent a good 12 hours in Nurdige. Nurdige is a town of around 50,000 people in the province of Gaziantep. And specifically there, the municipality were reporting to us that 70% of the buildings have been completely destroyed. Looking around, there were search and rescue operations going on in everywhere. Everywhere you look, there was a search and rescue going on, and it was really difficult. And you know, there were glimpses at times of hope when people would find somebody had been buried for 45, 50 hours. At that stage, it's that first critical 72 hours in which we believe are the key time in which we want to take people out of the rubble, and they still have that chance of survival. That's been badly impacted by the weather. There are sub-zero conditions. It's -6. It's very, very cold. The buildings completely collapsed. It's shocking to see it. It's widespread. Organizations like Islamic Relief, we're focused on assisting the Civil Protection Agency, who are working really, really hard in the search and rescue operations. They're going on throughout the night. Obviously, shortage of electricity, shortage of telecommunication, shortage of water supplies. Initially, in the first day, Monday evening, Tuesday, lots of the roads and access to certain areas was a real struggle. That is still a struggle in some places like Hatay, in one of the other provinces here in Turkey. That has improved, I must say. The access on the roads have improved. So we're able to have movement of vehicles and sort of aid in the areas that it needs to get to has become a lot better. The assistance of food, an absolute essential. People are cold, very, very cold. People who had buildings or were living in shelters that have not been destroyed, psychologically and emotionally, they're not, and understandably, they're not willing to return to those. And secondly, the authorities are encouraging people not to. A few hours ago in the morning, we still felt a tremor. And that tremor, and added to that, lots of the buildings that, yesterday in Nurdege where I was, yesterday was 45 hours post-earthquake. One of the buildings that I was standing in front of, part of it just collapsed because structurally, the damage that's been done, slowly, buildings will still collapse on their own when there is a tremor or just by the sheer impact of the earthquake. So people are unwilling to return to shelters. There's a mosque behind me, and I wanted to highlight this mosque because this was a mosque initially used as a shelter, but it's been, by one of the tremors, it originally been impacted. People were housed here and people have left. People have left it because it became completely unsafe. So initially we were using sports centers, mosques, schools, sort of big facilities that are at ground level that hadn't visually been impacted as much by the quake. But what actually is happening, people are refusing, even if we're offering them a place, they're refusing because of the psychological impact of what's happened. And therefore we're offering tents like other agencies are doing. We're finding a lot of families that are choosing actually to remain on the streets. They find that as a safe space. We're finding a lot of people burning fires, a lot of people sleeping in their cars. It's difficult. It's a real challenge. Shelter, food, materials to help people with the warmth. We did a distribution yesterday for blankets. I've never seen blankets be distributed as quickly as we did them yesterday. It was unbelievable. It was, just the need and how cold people were. Now what we're seeing is an increase in need in a lot of the toilet and sort of latrines and sanitation facilities because of the sheer numbers that are outside of their homes and what this is leading to. We're also now looking at some of the sort of medical challenges and the needs accordingly because of the fact that a lot of the hospital supplies need replenishing. That's going to be replenished now over the next couple of days, but people are starting to feel now the adrenaline of trying to find family members. What we're hearing now in some of the areas, this morning I was in Karaman, Manash, and they're starting to call off some of the search and rescue now. We still have hope, still people were being recovered this morning, but when that's happening now, people are starting to accept the loss of family members that may still be buried, which is really sad. But what now they're starting to focus and understand that the injury that they had, because the adrenaline is sort of worn off now, and as they start to accept the reality of what's going on, which is very hard to accept, they're realizing that the medical, the injury that is worse, there may be infections because of some of the damage. Because initially when it happened, people are not concerned about themselves, they're just concerned about family members. But we're getting a lot of people now with infections. Unfortunately, a lot of illnesses that are spread as people are sort of grouping up together or whatever else. The cleanliness and the facilities are, as you can imagine, very stretched. So the appeal, I guess, is clear. We need as much support as possible. We're here. We've been here since the onset of the crisis in Syria. So our operations are quite comprehensive, and it's put us in a unique position, as you mentioned in your introduction, where we've been able to, with the winterization that's going on at the moment because of the sub-zero conditions that we're working with, we already had existing sort of supplies that were in place. So we've been able to upscale. We need to upscale. All aid agencies now are looking to upscale because that would be the priority at such a stage, and to continue the work that's going on.
Thank you, Salah. And we will come back to you with some questions, hopefully towards the end. Thank you. I'd now like to introduce Dr. Wassal Jurk from Northern Syria. Dr. Jurk works for the Syrian Expatriate Medical Association, or SEMA, a local partner of DEC member charity Age International. Dr. Al-Jurk, can you tell us more about the situation in Syria? How is your organization responding, and what will be needed in the weeks and months to come?
Hi, colleagues. Thanks for giving this opportunity to brief the situation in northwest Syria. As earthquake was done 3 days ago. The situation is miserable in northwest Syria, as my colleague in Islamic Relief explained about the situation in Turkey. It's nearly comparable to the situation in Turkey, with a big difference about the capabilities available inside Syria, comparing with what the Turkish government has actually as a government in case of absence of any government inside Syria or any associations responding to the situation, except the civil defense with the minor capabilities and machinery, responding to the civilians under the rubble and the collapsed buildings. As civil defense announced, there are more than 1,700 of deaths, and more than 400 buildings collapsed in northwest Syria, especially in Jandaris, the rural of Afrin, Aleppo, and western to Idlib in Salqin, Sarmada, and Kafar Takharim. The Idlib Directorate and Health Cluster Turkey Hub announced more than 2,000 deaths and more than 12,000 injured people, and the rescue efforts is still continuing till now, with only the efforts of the civil defense in extracting the people under the rubble and the collapsed buildings. SEMA and other local NGOs are responding to this emergent situation by providing and provision of the essential health services regarding secondary health care in about 19 hospitals, and also with coordination with Health Cluster and WHO and UN agencies, who are providing these vital hospitals in this response with fuel, consumables, and other needs. SEMA is operating 3 of these surgical hospital. Actually, all of them are located in Idlib and near to Afrin and Jandaris, with capacity of about 200 beds, actually, with lack and shortage of fuel, medical consumables, and medication, and also shortage of staff, as many of the staff are affected as normal people by the earthquake and lost their families, and sometimes lost their lives, and most of them are escaping now to secure the shelter for their families. Actually, SEMA lost 2 of their field staff in the hospitals. One of them are female, which is working as a social mobilizer for vaccination program, and the surgical assistant lost his left arm, and the whole family and his house was collapsed by the earthquake, and lost his family, and he is now sleeping in the ICU unit in the same hospital who was working in. SEMA and other NGOs now responding in the affected areas, especially in Jandaris, by providing a temporary shelter, and SEMA now is preparing for a small center for rescuing and receiving the IDPs from the near and surrounding areas, providing them with some drinking water, with bread, with essential food basket, with ready to eat basket. The essential need now can be briefed by the essential medical consumables and medication, fuel for the hospital, as the electricity is off for the first 3 days of the earthquake, which was affected by the earthquake, as the rest of the infrastructure of the area, and other need may be the shelter, the drinking water, the sanitation and latrines. and some clothes and blankets to face the cold weather. As my colleague mentioned, it is sub-zero temperature in the area.
Thank you, Dr. Wassal, and our sympathies to the families and colleagues of those who have lost their lives, and our best wishes to your colleagues who are still receiving treatment. We will come back to you with some questions later on, and a reminder to those listening in, please do pop your questions into the Q&A, and we will come back to them towards the end of this press conference. I'd now like to introduce Rasha Nasruddin, Director of the Arab region for ActionAid, who have a particular focus on women and girls. Rasha, can you tell us a little bit about what ActionAid and your local partners are doing, and especially to the women and girls who've been affected by this disaster?
Yeah, thank you, Saleh. Thanks for having us today. Maybe just before focusing on women and girls, as as Dr. Wassel said, in northwest Syria, this earthquake hit this area, which was already affected by conflict for the past couple of years, and people there have been through multiple displacements. Health facilities, aid workers there are strained from years of conflict and attacks, and a lot of people has gone, as I said, lost their livelihoods not once or twice, but more. And women and girls in that area were already living in a very, very vulnerable conditions. Also, just before the earthquake hit, there was a cholera outbreak in the area, and there are already harsh weather conditions. So it came just in a moment where there was a lot of need. So it exacerbated the suffering of the people. That's why support needs to be redoubled for these communities. As I said, women and girls are usually face increased risk of discrimination, of abuse and violence during these times of crisis. What we have seen through and what was reported through our partner is that a lot of families, in majority who are of women and the children, have spent their nights on the streets. There is, for example, lack of tents. So our partners have been trying to set up temporary shelters, and through the work that we are doing with them, we're trying to equip these shelters with food, with blankets, with floor mats, so that it can provide especially women and girls with some sort of privacy. As Dr. Wassel also said, health facilities were also affected, and they were already affected by the conflict. So, for example, today we have limited maternity facilities. Pregnant women are facing risk of complications with their pregnancy. Menstruating girls have little privacy, don't have access to the right products to manage their periods. A lot of the women and girls safe spaces have been destructed. So this also means that women lack some access to these services, and this is really alarming. In terms of our response and what we immediately have done or prioritized is to help our partners with the search and rescue, because as colleagues had mentioned, that this is a gap, and especially in Syria there is a lack of equipment. So we're trying to provide the needed resources. So for local partners to perhaps rent these equipments from inside Syria to be able to remove people from under the rubble. Additional things to this response include, as I said, food and non-food items, shelter, hygiene kits, fuel. There is a lack of electricity. There's a lack of electricity in health facilities and the temporary shelters. That also affects the well-being of women and girls. That affect their and increases their exposure. In addition to that, we should not forget the psychosocial support that is very much needed. So we just started yesterday mobile psychosocial support services for children, including young girls, and we will be also setting up alternative women safe spaces that were already lost due to destruction, so women can have access to these, and some also GBV related services, because this is very much needed in the areas. This is basically the general picture. As I said, the area there is in a huge need and has been going through a lot. So that's why it needs more focus. We need to redouble the support for this area to be, especially the northwest of Syria. Dr. Wasil mentioned like Sarmada, like Salkin, there is Harem, Genderis is another area that is very much affected. All of these areas, I mean, we are trying first to move to the most affected areas, but also not to miss that there are other areas, of course, less affected, but they also need a lot. Yeah, that's it from our end. Thank you.
Thank you. Thank you. Our final panelist is Jeremy Smith, Head of Region for the British Red Cross. Jeremy, through the Red Cross and the Red Crescent family, you are working in both Turkey and northern Syria. Can you tell us a little bit about your rapid response, please?
Thanks, Salah. Yeah, that's correct. I mean, within 10 minutes of the earthquake happening in Aleppo in northern Syria, we had Syrian Red Crescent ambulances responding, heading to the sites. Search and rescue was the priority for the first 72 hours of this response, and Syrian Red Crescent and Turkish Red Crescent volunteers and staff were supporting in the search and rescue effort, trying to find people under rubble, getting them to emergency medical equipment centers as quickly as possible. We also mobilized the International Red Crescent response. So the Lebanese Red Cross sent a search and rescue team on Monday to Turkey and in the early hours of Tuesday morning into Syria to help with the search and rescue, to relieve people who've been working more than 24 hours straight, digging through the rubble. But adjacent to that, you know, we want to ensure that we're responding to the needs of the survivors and keeping them alive and keeping them safe and keeping them healthy. You know, the other panelists have talked about this as well, but ensuring blankets and tents. The Turkish Red Crescent have been supporting this with more than 2,000 tents. They've supported with 500,000 meals. They have 77 food trucks at the moment trying to get hot meals to people in Syria. Blankets, tents, mattresses have been distributed in Hama, in Aleppo by Syrian Red Crescent volunteers, and that will continue. We know that, you know, as others have said, people don't want to return home, that they're scared. It's understandable, but we want to ensure that people have as much as possible a safe place to sleep at the moment. As Rasha said, you know, this is really a crisis within a crisis. Is in Syria. We've just had a cholera outbreak. We had a winter storm the week before this happened. Temperatures are below freezing. So we want to make sure that we can get immediate response there as much as possible in Syria and in Turkey. But our teams there at the moment are also doing psychosocial first aid. We have 10 teams in Turkey supporting people with psychological first aid, supporting building the framework for longer term mental health support. But also doing assessments in Syria and in Turkey, doing that kind of household assessment, trying to get an accurate picture with other aid organizations to see what the scale of this will be for the long-term recovery. I mean, we know from other disasters we've been responding to that this is not going to be a matter of weeks or months. This is going to be a multi-year long-term recovery. And this is why we need a lot of support and we need people to give generously. Because as important as the short-term needs are now, we know that we're also going to have long-term needs of people who have lifelong injuries, who have significant psychological issues, who may not be able to return to their livelihood. And so we need to make sure that we're set up to support people in the long term.
Thank you, Jeremy. We've now come to the point where we open up the floor for any questions, and I can see there are several questions in the Q&A box. The first one is for Dr. Wasil, and the question from Tim Sigsworth from the Press Association is, what is your message for the British public to donate to the appeal?
Yes, actually, in that situation, with cumulative bad conditions on the Syrian people, from war to freezing season to earthquake to lack and shortage of all kinds of the support and aid, and the resolution of the Security Council and difficulties in UN agencies to deliver many aspects of the support to the Syrian people. There are high needs for securing shelter, for medical aid, for drinking water and some food items and non-food items, and heating, fuel and electricity, and supporting civil defense in efforts of rescuing the trapping people under the rubble and the collapse buildings, to mitigate the impact of the earthquake for the Syrian people, as there are more than 4,000 family in Genderis itself.
Sorry, we seem to have lost there. I hope the question was responded there, but we'll move on. The next question is from Molly Blackhall from the I newspaper. Molly, the couple of questions here.
Sorry, I lost the connection. It's okay
sorry,
now?
We'll come back to you at the end, sorry. So the question from Molly from the I newspaper is here we go. There are lots of discussion about the first 72 hours being crucial for saving people trapped under rubble. As that now has passed, is the focus of the appeal going to be more on the needs of those affected by the earthquake, such as shelter, healthcare, rather than search and rescue? Well, Molly, as you've seen, several of our members have already been supporting search and rescue, and DEC charities are on the ground and are drawing down appeal funds as we speak. But sadly, time is running out, as we've said, for pulling people out, and there are millions of people in need of humanitarian assistance, and that's what the focus of the appeal will be as we speak about that: food, water and shelter. The second question is around what is the risk of further aftershocks and more quakes? And I wonder, Salah, are you still with us? We've lost Salah. Perhaps Jeremy, I can come to you on this question. What's the risks of further?
Yes,
shock?
I'm here. Can you hear me? Sorry.
Yes, we can hear you. Go ahead, Salah.
Sorry, I lost some signal where I was. Yeah, look, there was a small after sort of a tremor this morning. I felt it myself. It's a very, it's very scary when it happens, and you see the impact that it has around people. There is still that risk. The further that days go on, the feeling and the hope is that there is less risk of the tremors because of the time, that's passed from the initial earthquake that took place.
Thank you. We have a question here from Ian Eddy. Do you have any idea how many schools have been destroyed and how children will be able to continue their education? Also, how many people have been made homeless and how will they be housed? Are tents the main solution, and what's the more long-term plan? Perhaps, Jeremy, if I can come to you, and Rasha, if you've got anything to add on to that, that'd be great. Jeremy.
Yeah, it's a great question. And I think, something to emphasize is the full scale of this is still really hard to get in numbers. We're doing the assessments on the ground. We've mobilized our local volunteers. We're working with, UN colleagues and other aid organization colleagues to try and get an accurate idea of just how many schools have been damaged, what the long-term recovery is going to be. Ensuring that full recovery means schools, it means water and infrastructure, it means healthcare, it means all of the necessary, services for a society to function. And, when we talk about a long-term recovery, that's what we're talking about. At the moment, exact numbers, we're not sure, but we know that for children especially, this is a life-changing event. This is an incredibly traumatic event to wake up in the middle of the night and then to have, multiple days of search and rescue, of being in that, sleeping in the cold. So we want to ensure that, education is recovered, but also, mental health support for children and psychosocial recovery for children is also prioritized in its response.
Thank you, Jeremy. Rasha, anything you want to add on to this?
Yeah, just to agree with Jeremy, I think the picture is still developing, and the immediate response focused on mainly the basic needs. One thing that we are already also doing and providing is the mobile psychosocial support services for children, and I think that is extremely important at the moment for children. And I think as we progress, there is a big question about education. Education is always missed from responses, but I think it's a priority, to something to be discussing later once the full picture is clearer.
Thank you, Rasha, and thank you, Jeremy and Dr. Wassel and Salah in Turkey. We'll now draw to a close, but before I do, I want to thank all our speakers, especially at this very busy time, for all that you and your teams are doing responding to the disaster. As we've heard, the DEC charities have been responding since the earthquake struck. Aid is being delivered as we speak, but there is much more to do. The priority right now is to help save lives through search and rescue and emergency medical care. Sadly, hundreds of thousands have lost their homes and need shelter, warmth, and hot food to survive the freezing conditions. The scale of the damage is hard to imagine, with thousands of buildings reduced to rubble. This is happening in a region where millions of people had already been forced to flee the war in Syria. Donations from the British public will make a huge difference in enabling DEC charities to reach more people. We, of course, appreciate that this is a difficult time for all of us, but we're urging everyone to give whatever they can. The UK government is aid matching up to 5 million for the DEC earthquake appeal, pound for pound. So for each pound a member of the public gives, the UK government will match the first 5 million. As we speak, DEC charities are already drawing down funds to provide that life-saving assistance. £10 could provide blankets for 2 people. £25 could provide emergency food for a family for 10 days. And £50 could provide emergency shelter for 2 families. Thank you for listening.